So we conducted this systematic review meta-analyses of 55 double-blinded, placebo-controlled, randomized controlled trials, including over 100,000 participants across indications such as type 2 diabetes, overweight and obesity, and NASH. And we looked at serious GI and biliary adverse events such as cholelithiasis, or GERD, gastroesophageal reflux disease, pancreatitis, cholecystitis, intestinal obstruction, gastritis, and esophagitis, and other related events. We found that GLP-1 receptor agonists increase the risk of cholelithiasis by approximately 50%, which is a risk ratio of 1.46, translating to about 2 additional cases per 1,000 patients. We also found that GLP-1 receptor agonists increase the risk of GERD by approximately twofold, with a risk ratio of 2.19, and this corresponds to roughly about 4 more cases per 1,000 patients. There's no meaningful increase in the risk of other GI or biliary adverse events such as pancreatitis, cholecystitis, bowel obstruction, and gastritis, esophagitis. So I think the increase in cholelithiasis or formation of gallstones and acid reflux in GERD, it kind of reflects kind of pathophysiologic effects rather than broad GI toxicity associated GLP-1 receptor agonists. So the increase in gallstone formation of cholelithiasis likely results from rapid weight loss, which has by itself been associated with formation of gallstones, changes in cholesterol metabolism, and gallbladder stasis, associated with the use of GLP-1 receptor agonists. For GERD, so GLP-1 receptor agonists, they target gastric emptying, they delay gastric emptying directly and relaxes the lower esophageal sphincter. So physiologically, they can induce slower contraction of the gastric wall, and so causing GERD. And so this is a known effect of GLP-1 receptor activation. So what's interesting is that we did not find an increased risk of pancreatitis or bowel obstruction. Prior to our studies, there were data from observational studies reporting an increased risk of pancreatitis or bowel obstruction. But our study derived from RCTs actually suggests that GLP-1 receptor agonists may not increase the risk of these serious adverse events. And so overall, it seems that GLP-1 receptor agonists may actually be safer than previously reported. Absolutely. So outcome analysis did show numerically higher rates of cholelithiasis and GERD among patients overweight, obesity, or those with NASH, or in trials using higher doses or more potent weight loss agents. We did not see a statistical significance, but I do think that there are clinical relevance. So, for example, in trials investigating GLP-1 RAs as a weight loss agent in patients with overweight or obesity, they tend to use a higher dose of GLP-1 RAs that can, induce weight loss. And I think in part, this is contributing to the observed increased risk of cholelithiasis and GERD. Again, physiologically, we discussed before. And so I think it is reasonable to believe that higher doses of GLP-1 RAs can increase the risk of these adverse events. So clinically, providers should remain alert in patients with overweight or obesity, or when we are using higher doses of GLP-1 RAs. Yeah, this is a really great question. So I think overall meta-analyses kind of suggest a kind of overall favorable safety profile for the use of GLP-1 RAs. There's an increased risk for cholelithiasis and GERD, but these are very low absolute increases in the risk. It's 2 per 1,000 patients for cholelithiasis and 4 per 1,000 patients for GERD. So, when we weigh the risk and benefits against the, obvious and clear metabolic benefits such as weight loss, glycemic control, and cardiovascular risk reduction, these mild, so-called mild GI risks does appear to be manageable. And I think going forward, um, we can build kind of a better strategy. Well, further studies will help us understand which patients are more prone or susceptible to getting these GI side effects. But I think overall, with the clear metabolic benefits, I think it's going to be worthwhile and beneficial for patients in the long run. Yeah, so I think what's really needed going forward would be, a couple of things. One thing is because our data is derived from randomized controlled trials, which are often selective. They may not truly represent what's the real world population. So I think, data from the real world outside of the clinical trial context will help us see if these GI side effects, it's can be extended to patients who are not otherwise being enrolled in a clinical trial. Second thing is, some of the high-risk subgroups. So, for example, patients with prior cholelithiasis or prior GERD, um, can can they have like worsening symptoms or worsening gallstones or complications from that from the use of GLP-1 RAs? This is also something that needs to be clarified, as well as those with prior pancreatitis, which, up to now, many of the trials still exclude patients with prior pancreatitis because it was kind of well known, at least prior to this study, that GLP-1 RAs can induce pancreatitis. So I think this will be an important subgroups because there are a lot of patients who are not getting treatment for GLP-1 RAs because they have prior pancreatitis. Also, studies on novel GLP-1 RAs that are not clinically approved yet by the FDA, which we excluded from our study, and this also includes dual agonists and triple agonists that are being developed and under investigation. And a longer follow-up period will be helpful to see the long-term effects of GLP-1 RAs.